So the ideal table for Lite Force Technique is an elevation table that goes up and down. But you don't need that type of table. You can also use a fixed height table. The ideal height, if you have a fixed height table, is classic massage table height, which means that when I place my hand on the table with my wrist extended, it is a very comfortable fit. And that's a good height for Lite Force Technique. So when you make a contact, you're going to make a contact with the pisiform bone of the wrist. And that's a very solid, safe contact. It's really hard to hurt yourself using a pisiform contact. And the wrist is in what we call the neutral anatomical position, which is extremely safe for the wrist. So I use my pisiform bone to contact the lower lumbar spine with my thumb up, and I ask the patient to arch their back and then relax. And keep arching and relaxing. We create a very nice rhythm that's very comfortable for the patient and allows me to palpate and treat. And when I find a spot that's tight, I will ask the patient to arch their back a little more and hold, and then relax. That's if something is really tight. If it's not that tight, I can just go up and down the spine, mobilizing the spine very gently and very comfortably. Sometimes when you say arch your back, stick your belly out, the patient doesn't quite get it. And in that case, you need to show the patient what that means. So when I say arch your back, stick your belly out, I mean to arch your back and stick your belly out in that way. Let's have you arch your back, stick your belly out. Perfect. So when you start treating the lower back, you can start at the crest of the hip bone and come down just about an inch, and that's the fifth lumbar, L5-S1. I put my pisiform on that spot, then I ask the patient to arch your back, stick your belly out, and keep going, please. And when I do that, I can feel that the lower lumbar spine is the tightest, so I'm going to spend a little more time down here. And I'm going to ask you to arch your back and hold, and then I get more pressure, and then relax, and then arch and relax. And then I get the rest of the lumbar spine, so it feels nice and mobile and supple. When treating the middle to upper thoracic spine, it's more effective if you take the patient's arm and place it on their hip. That gives you a lever to hold on to. So I can now do the same thing and say, with my pisiform just lateral to the spine, on the left side of the spine, I say arch your back and then relax. And keep going, please. And I'm really palpating now until I find a very stiff spot. And that's quite stiff, and the thoracolumbar spine is usually quite stiff. So I feel a tight spot right there. So I'm going to say arch your back and hold, and then relax. And then I recheck it, and that feels great. There's one more spot down here in the thoracolumbar spine. Arch your back and hold, and then relax. And now we've mobilized the whole lumbar and most of the thoracic spine. Sometimes you'll find a patient is very, very stiff in a certain area, and you want to use more force to move the joint. If that in fact is true, what you do is you stick your elbow against your body, then you just lunge forward. Arch and relax, please, and arch. And that way I'm not using my arm, my forearm, my wrist in any way that could stress my arm or forearm. So that's a way to deal with a patient who's really tight. You notice how I'm just gently lunging forward to mobilize this area.